device that we use in this study was not the device that people, they have two devices, the leads, for example. One is an 8-contact lead that's kind of stacked one on top of the other. That's what was used in this study. But Boston Scientific has a segmented lead now called the 1331 that's similar to another segmented lead another company has, other than the fact that they have multiple independent current sources for it. So in this study, we did not use the quote segmented or directional lead because it wasn't available at that time. And we didn't want to get halfway through a study and then do a different lead, right? So we stayed with this 8-contact lead. I think probably most implantations with this company now are using their segmented lead. And again, they have multiple independent current sources. So each of the contacts has a separate current source. And the reason that's important is you have a little better control over the amount of current that's being delivered through each of these contacts. Or if you have for example, the new direction lead that they have through each of the segments. The problem is if you have different impedances around these different contacts, if you have a single source current, then you may not have as good a control over delivering the precise amount of current through each of the segments. However, in this case, because you have independent current sources, you can put as much or as little as you want through each of the segments. And that was one of the unique features, I think, about this device. I think for them, obviously, they're looking to get their device approved by the FDA, which they did. That was the goal of the study for them. But I think because the study was set up a little differently than a lot of the other studies that have been done this way, it was a randomized control study, double-blind, and it had a sham control. Most studies really don't have the double-blind sham control aspect to it. And it's, I think it's, from that aspect, is pretty unique. And it provides really kind of the best way to look at what deep brain stimulation can do, because you are blinded as an investigator and the patient's blinded as a patient receiving it. Again, we're doing sham stimulation, which is really a small amount of current. It's on for a small amount of time, off for a much larger amount of time. I think it was like 10th of milliamp, 2 hertz, on for just a few seconds and then off for 90 minutes. So really, essentially not delivering any stim. But the patients were all implanted. And the patient has to guess whether or not they might be getting benefit, right? I think with these types of studies, we did look at the blind. So we have questionnaires asking you, do you think you're stimulated, or do you think you're in the control group that's being sham stimulated? We haven't looked at that data yet. We do need to look at that. I think it's going to be important. But when you have the degree of benefit with deep brain stimulation, it's pretty hard to blind people. I mean, if they're getting a lot better, they pretty much assume that, they're getting it. And if they don't see much benefit, then they're kind of thinking, I don't think I got it. But it's going to be curious because, sometimes you can be surprised. Patients can convince themselves they're really getting better. And sometimes they actually get a little bit better because they've convinced themselves they're going to get better. And this has been kind of the placebo effect we've seen a lot of times with therapies. And with deep brain stimulation, because in this study, everybody got implanted. There can be a little bit of what we call a lesion effect or a stun effect. When you put a lead in the tissue, you can kind of disrupt the tissue a little bit. And there may be some local chemical changes that occur as well. And patients sometimes get better just from putting the lead in there and not turning on the stimulator. So, we did see some of that as well. But that was controlled for in this study because we compared people after implantation during the blinded phase. And then when it wasn't blinded after 3 months, then we opened it up and it was open label. The patients knew that they were getting stimulation. The investigator knew what they were doing pretty much. And then we also compared the data at 3 months, 6 months, and every year thereafter to screening data. So before they were implanted. And I think that's another aspect about the study. But when we did this comparing to the implantation, after implantation, that's different. Most people don't do that. Most studies are looking at what am I like at screening before I get implanted? And then what happened to me 3 months later, 6 months later, that kind of thing. But I think the way it was designed was very nice, actually. It's hard to get a study like this funded through other means other than through industry, I think. So we're very fortunate. This is a unique data set, I think. It's going to provide a lot of interesting data and understanding about DBS going forward.